Thank you very much, Mr. Chairman, and delighted to be here, ladies and gentlemen. I'm the last speaker, so hopefully you have still some energy to listen to me and maybe to have some opinions afterward. After all these interesting presentations in the morning and the afternoon, I try to give some kind of view from a software services IT provider. How do we see the healthcare IT market, and what are the opportunities, and maybe also the challenges in digitalization. And of course, I will start a little bit with some marketing slides, because it's always good to market the company where you're working in. And Tietoa is a well-known company, I think in Finland. Starts to be also a well-known company in Scandinavia. Hopefully will be a very well-known company in Europe. I myself, I moved last week to Cologne. I'm staying there now, and my job is to really explode and try to grow the business in Europe in the healthcare area. And we have a lot of challenges. Looking at basics of Tietoa, we are already very international. We are in many countries, rather exotic countries also, and we are a listed company. We are mainly working with two business logics. Either we are providing solutions, international global solutions, or we are doing partnerships. In partnerships, we mean that we really try to understand the deep heart of the business of the customer and really try to provide all the services and knowledge we have and combine it with the customer's knowledge. So these are the areas where we are very, let's say, active for the moment. I will start with forest. We are the leading provider in the world of supplying production systems in the forest industry. We also are the leading provider in R&D for mobile communications, having good customers like Nokia, Ericsson, Siemens, Alcatel. And we are a very leading one in the banking area, talking about internet banking. And then we move to healthcare. Healthcare is a new area, actually, that we started up about 5-6 years ago. And as told here, we now during this summer, we put up a new business area called healthcare and welfare. And we are now, let's say, heading for the international market. So today, we are present in 7 countries. We have operations also in 10 countries. We have more than 1,000 professionals. We have a lot of doctors, nurses working with our organizations, a lot of end users already in the Northern Europe arena, and we are getting a better turnover all the time. And a very exotic thing for us also, starting from January, we have more than 200 people working for us in India. We have an own company developing our software. And for us, it's a very new start, and we are looking very forward to this internationalization. So that was the marketing slides about our company. Let's go to the healthcare IT a little bit, look at the basics. I think for many of this, for you, this is a very national thing that you know about this. But I want to point out that the healthcare industry is very data incentive. We already have heard it through many presentations. Even some are saying that 70% of the total workload is really data incentive in the healthcare industry or in the IT area. We also knew that before millennium, it was not so much putting effort on, let's say, the real system. It was only administrational, based on administrational systems. But now, after millennium, we have put much more effort into this. And also, we have heard, and we know that still many of the core of the treatment information has been on paper format and very fragmented in various systems. Transfer of data between systems has also been very difficult, maybe non-existing up to now. And the service processes have very been manually driven. And today, in Europe, hospitals, they spend about 2% of their budgets on IT. In the States, I've heard it's about 5 to 6%. So in the States, they are putting much more money into the IT. We think that now in Europe, when we're starting to implement the new area of digitalization of healthcare, it will double up to 3-4%. This will happen during the next 5 years. IT industry is very public driven. I have been visiting many hospitals during the last months and discussed with directors, and I can see the problematic of making decisions, because it's very political, it's public driven, and it's difficult to get consensus. We also have the problem that we have very local fragmented companies, usually start up by some public funding, and then we are stuck into the system and we are not able to get out of that. National standards have been put up, but not international standards. And it has been a very, very heavy influence from the IT, the local IT in the company, that has been driving, let's say, the development of the IT within healthcare. And looking at the international market, it has been very hardware-driven, equipment that has been internationally sold, but not much in the software industry. We don't have any real big players in the software industry. There are some, but not if you compare with other industries. And we have a huge number of applications today that we need to integrate to get this thing work. And we are now, in the healthcare industry, taking the first step to really, let's say, have a structure. Still, we think that this structure that we have today is not actually supporting digitalization of the healthcare, because we are too many, two different companies that are working with these kind of issues. And we haven't been able to get the consensus of doing together. But I hope that we can do it, and we can see also the load of acquisition that is happening now around the world. Yesterday, once again, I saw a large acquisition in the healthcare area. Company in Europe that bought a company in Spain. So this is happening all the time, and we are integrating now. Okay, we of course have a big potential in this ICT environment in the healthcare area. We know that we are aging, all of us. I'm going to be more demanding in the future when I'm getting old. I want to have this done through self-services and systems. There will be new care possibilities. And of course there will be a pressure of money. I don't think that we will get more money from the government to put on IT. We have to, with this money that we have now, we have to get more and more, let's say, value for that what we have. And of course there is privatization of healthcare is coming very, very largely in this picture. And we see also the governments are very actively trying to find now solutions. We already have seen today here examples of what we are trying to do on the national levels. And I think most of the countries in Europe today, they really are trying to head for national issues and national, let's say, combinations. And we also see that we have already, from our point of view, a lot of regional things. When I look at Scandinavia, almost all countries have some kind of regional, let's say, constellations today to start to work in healthcare. So there mainly are, let's say, three changes that we think that will let's say, give a boost in the IT industry. First of all, I think that digitalization of the process, the clinical processes, is really, let's say, the thing that is starting to happen now. We already have seen examples, but now we will do it much more during the coming 5 years. Also, the communication between providers is a must. Otherwise, we can't get the data to move between the different systems. And we need a self-service point of, let's say, services also in this area. We already heard this morning about banking, and as an example, we know that in Finland 95% of all transactions that is done in banks, excluding retail, is done by us already. But in the public area, in the healthcare area, it's not many percentage today that is done. Information is giving, but we are not able to do something with that information or give feedback back. So there will be a major change in the industry from our point of view. And we have a big challenge here. I think that during the next 5 years we need to change the legacy, because we don't have any more IT and technology that is supporting all the legacy that we have today. When I talk about competition, I say that the big competition for us as a company is usually not the other competitors. It's the internal legacy systems that we have in all the hospitals. That's still the big competition that we are facing when discussing about changes. And also we are looking and seeing much kind of consolidation and outsourcing issues. Many companies hospitals are now talking about, could you take care of our systems more widely, not only, let's say, this special, let's say, treatment system or clinical software. So we think that really the market will multiply by end of this decade. So what are the drivers then for let's say, demand? Once again, I think what everyone has been talking about today, to get the information stored in one place, really digitalize the patient information systems. And also, once again, to get the communication to be worked between the different systems. But also, let's say, we need to have more standards to be able to start to work together. Otherwise, we can't really integrate our systems. And of course, mobile solutions. That's something that is coming already very much. We can see it, let's say, if you go to the area of welfare. Definitely there are mobile solutions already in use. Having, let's say, easy ways of booking times and then giving information about the patients or, let's say, the treated persons. And of course, when I talked earlier about consolidation of IT industry, that's going on, and that's going to be during the next, I think, 2-3 years, very heavy. So what is the development potential then, if you look at that from our point of view? Once again, we are going back to this, what we call the clinical treatment support. We think that there is a lot of new issues coming up very rapidly during the next coming 2 years. Back to the situation, having information everywhere and every time. Telemedicine coming as a very, very fast, rapid new issue. And also, let's say, imaging. I talked to one of the laboratory directors yesterday, and he said he get a lot of information on paper about samples and things, but he doesn't need that. He wants to have some kind of pictures, imaging about what's going on in the patient. And then, of course, the process management. We need to change that, and there's a lot of things that we can do together, and we have to understand the processes. One question that I often get when I visit the hospitals, that how can we get these treatment processes and the IT technology processes to be together? We need to sit the people down and to understand both sides of the coin. And then we can do something together. Of course, data analysis, more online decision support, and having, let's say, online treatment and digitalization. And of course, once again, the communication and new services. So these are what we feel the 4 areas where we see that there is going to happen from technology point of view a lot in the coming years. We are there. We have started the digitalization of healthcare processes in our company. This is what we are doing today. Heavily, of course, concentrating on patient administration, HIS systems, home care. We also see that one part of healthcare is elderly care today. Elderly care is not happening in the hospitals. It can happen also in the home. It's maybe handled by the social security or social welfare organizations. Pictures, radiology, it's very, very important. Speed recognition, something that we are testing very much now in Finland. Doctors using directly, let's say, information into the database by speaking. And that's working even in Finnish language. Laboratory information, dental. I understand that we have a very, very high-level sophisticated dental system in Finland. When we had the unfortunate tsunami catastrophe, we were able very fast to identify our victims because we had very good records. And of course, the SMS system, that is daily for everyone to use the SMS and get bookings, non-bookings, and so on. We have actually been thinking about this as a 7-layer issue in the services from our point of view. Starting with integration and then the platform issues and ending with the self-services issues. And actually it's a very lot of text on this, I don't want to go through this, but maybe the next picture, that's our product portfolio, what we are selling today to our customers. Starting from integration, platform, workflow, administration, specialist applications that is needed to be able to do treatments. Then we have instrument integration applications, we have documentation, the decision support tools and issues. And then, of course, we have this regional communication solution that you have to be able to combine these issues. And in the end, it's a mobile citizen services issue. You should be able in the future to have it on your mobile. And here we are also working very close to mobile companies to make this work. And a little bit, as I said already, in this business area we don't only have healthcare, we also have welfare. It's a decision that we took some years ago that we feel that welfare is very, very combined with healthcare in the future. So that it will be more and more combined, and we don't see it as a separate, let's say, business even. So what are other key drivers for us in Tietonato? Why do we think that we could do something in this area of digitalization of healthcare? The first is we have a good partnership. We have been working for 30 years with a lot of high-level good hospitals in the Nordic area that really know what they are doing. We have a very lean and good product development organization that also understands technology and the treatment, let's say, processes that is needed to be able to do some better systems. And Nordic, once again, as a test environment, is a very, very good platform. We feel that we have a very, very good, let's say, healthcare overall, let's say, society, very well built. And of course, internationalization, and then we have this also, let's say, possibility to make software cheaper for our customers in the future by using offshore. So I hope that you can trust us in the future, and we can do it together. And as actually our slogan is Let's Care for Healthcare. We think also it's very important to understand the patient and the customer behind our systems, not only selling systems to hospitals, institutions, and getting some money out of there. You also need to understand the whole process, and you need to understand the individual. And sooner or later, we are also ourselves using these systems. So we really can look at it from that window point. So that was, for me, on a short introduction to this area. Maybe there are questions or comments.
Thank you, Carl-Johan.